Learn about the healing process for the Acne Scar Vitalizer with this image and video healing diary so you can prepare for your recovery and schedule your life better. We're also going to teach you how to clean so you can get results just like this person in a video later on. This is Dr. Young and we're Aesthetic Facial Body Plastic Surgery from Seattle, Bellevue, Washington. These next 4 images show a 20-something Indian male from Canada before receiving the Acne Scar Vitalizer treatment. Notice the ice pick and boxcar scars in these images shown with flash, overhead light, and no flash. The scars look different depending on lighting and the situation. They are worse in overhead lighting, as you probably know. Here comes the healing diary for you to know what to expect. Here's day 2 after the Acne Scar Vitalizer. He's doing great with the cleaning and there is no significant crusting nor oozing. Here's an example of someone on day 2 that has too much crusting. It's important to take this off with constant cleaning. Sometimes doing it every hour is needed. Later we'll show you a video on how to clean. Here's day 3 for our featured patient. The skin is more red but the crusting is still well controlled. Importantly, our featured patient's treatment was much more aggressive than the other patient, but he appears to be healing a lot faster. Here's day 3 for the other patient who used traditional approaches to cleaning 2 to 4 times a day. Notice how our patient was able to be in a better position with more frequent cleaning. Our featured patient on day 4 is getting better. There is less redness and the crusting is still under control. His frequent cleaning is paying off. This other patient has started to clean more and is catching up. Faster healing and less chance of infection and scarring comes with more frequent cleaning like our featured patient. Day 5 for our featured patient. The redness is coming down more. The scars look like they're filling in. Day 5 for the traditionally managed patient. Her redness looks more intense, but luckily this patient was able to catch up and avoid infections and scarring. But her redness will be prolonged and she will have a greater chance for hyperpigmentation. Day 6 for the featured patient. His redness is a little better, and the scars look like they are on their way to becoming much more improved. On the same day, this patient seems to be much more red and irritated. Skipping to day 9, the skin is much less red except in the deeper scars that are filling in for our featured patient. There are areas that now seem to have normal pigment and no redness. On day 9, this patient had more redness all around, whereas the more aggressively treated featured patient has more redness in the deeply treated scars and has almost normal pigment in other areas that have healed. Next, we present a video on cleaning to help you with your aftercare. This person was on day 2 after the Acne Scar Vitalizer treatment. Notice that the skin looks pretty clean. If you look closer, however, you will find a thin layer starting to form. Here we show a still image demonstrating the layer that we are about to remove with gentle cleaning in more of the video that will continue. And here we are, removing the thin layer that keeps getting thicker as day 2 to 4 emerge. With the discomfort in cleaning, you will feel like stopping. One thing to realize is that the more crusting there is and the longer the crusting stays on, your pain will increase to an unmanageable degree. Being persistent and frequent with the cleaning is the key. We recommend you cleaning almost every hour during the first few days. We also recommend waking up every 3 hours when you're sleeping to continue the cleaning to avoid the crusting taking over your healing. Thank you for watching. Call us so we can help you with the Acne Scar Vitalizer treatment.